And good morning. It's March 13, 2024. I'm here with one of my lovely patients who came to us with back pain. Turned out her pain was coming from what we call the facet joints. What is the facet joint? Well, it's a small joint in the back of your spine, and you have a pair of facet joints for every disc. So the discs are large joints in the front of your spine between your vertebrae or bones, and they're a huge cushion between the bones so that when you're bending and twisting and moving, you put pressure on the discs and the bones don't rub on each other. But nobody really talks about the facet joints, which is the second type of joint in the spine. Now, it turns out that discs cause 85% of chronic back pain. People that come here to see us with chronic back pain, 85% of the time, it's coming from a disc injury or more than one disc. And then 10% of the time, it's coming from the facet joints. It turns out, in her case, it was her facet joints. Now, she has a very badly damaged disc. And if you look at it on the MRI and x-rays, a surgeon would say, oh my gosh, it looks terrible. It's severely degenerated, but it was not causing your pain. Do you have any pain in your back today?
I don't, which is insane because I had my surgery yesterday. I'm over the moon because I am a practicing yogi and I enjoy movement and my body. And this is something that's been really bothering me. I mean, I'm not, like some of your patients, I can walk and I can move, but I was in pain. And so to have it be less than 24 hours later, and I feel great, absolutely great. And the things that hurt me don't hurt me today.
A lot of people say, oh, maybe your patients are feeling good because of the pain medicine they're taking. Are you taking
anything?
anything?
I'm not taking anything.
Yeah,
I'm
no
taking
pain
literally,
medicine.
not even Tylenol. And I was if there's such a thing as addicted to Tylenol, but I was taking probably too much, but I'm taking nothing. Absolutely nothing.
And you're all smiles today.
I am. And I have to say one other thing. Your whole team here, Dr. Deuk, is fantastic. They have been beyond caring and kind and just delightful.
Thank you.
Every step of the way. So that's something that really gave me a lot of comfort too.
I agree with you. We have the best team we've ever had
They are
here
wonderful.
today. So I'm very pleased with them. Thank you for saying that. Now, what was life like before your surgery yesterday?
I would listen to my body, and if it was really in a lot of pain, I was not doing things, and I was always careful with lifting or twisting, specifically twisting. And many times I would throw my back out, so then you're out, so you've got to be really careful. I was just maneuvering around it, I would say.
When your back went out, how long did it go out?
Typically about a week. I would be flat on my back for 2-3 days and then slowly moving into things.
And we made a diagnosis of facet joint pain. And
Which I've never heard of before.
Had you sought counsel from another surgeon about your back in the past?
Not from another surgeon. I'd done a lot of research. I had been to chiropractors, acupuncturists. I've had MRIs and x-rays and been told I have a badly herniated disc. When you read up on that, it's very scary. 6 months of recovery to 8 months of recovery.
Mm-hmm.
And I just wasn't willing to do that.
Did we fix your disc yesterday?
You did not.
So were those doctors right that it was your disc that was causing your pain?
Probably not.
They were not, because we didn't fix your disc.
No.
We fixed your facet joints. Well, what's life looking like for you now that your back is fixed?
I can't wait. I'm excited, and I'm off to Zurich in France in a couple weeks, and I'm not going to worry about my back. I mean, life is pretty darn good.
Awesome. And you can see in this video here, we went in with a tiny 4mm incision and went in and basically fixed her facet joint pain with a little probe. And the procedure is called the Deuk plasma rhizotomy because I pioneered it here at Deuk Spine Institute. It's the first of its kind. It will be the future. We just have to get these doctors around the country to adopt this new technology. Congratulations.
Thank you.
Anything else you want to say to your fans out there?
No, I just want to be sure and tell them that if you are even considering anything, first, come here, get a real diagnosis, because this is something I never heard of and I never would have researched. So my grandchildren and I will get to play a lot more.
There's a little story to how we met, and that is that my mom is in a community down the road, and she said, you should come here and give a talk about what you're doing. I thought, why not? For mom, right? Mom had asked me to do it, I'll do it. So we set up a nice luncheon, and I came and I addressed probably 30 of the residents. I think you were there.
I wasn't.
Oh, you weren't there. You heard about it.
I wasn't able to be there, but I saw it. I saw the advertising in the community.
And here you are.
And I came here because of that. And then I did get to meet your mom, who was absolutely delightful.
Thank you.
So that was fun too. Just a little connection.
All right. Well, congratulations.
Thank you so much.
Enjoy your travels
Thank you.
and the rest of your life.
Have a lovely day.
Thank you.